Hey y'all! Tonight we're talking about all things anti-aging with Dr. Terry Beck.
Let's have a toast, 'cause we don't care.
Nick, why are you wearing my mask?
This thing is outrageous.
You look more and more
It's
like
so
Hannibal
cool.
Lecter.
It's awesome. It's like kind of like a Power Ranger slash
Superhero.
Hannibal
Lecter. Yeah.
What does this thing do?
Okay, so this is Dr. Dennis Gross makes this mask. It is the Spectralite Face Wear Pro. It has your red and blue light therapy, which we use up here all the time. We use this in Tanya's Holistic Haven in there.
Yes.
We use it in the Remedy Room. We have the Saluma, which is the same thing. It's the red and blue light therapy. So your blue light therapy is going to be good for acne. It's antibacterial, antimicrobial, and so it helps to clear up any problematic or acne-prone skin that you've got. But the red light, which is my big go-to, it's anti-aging. It's for wrinkles. It promotes hydration and collagen production. But one of the biggest reasons that I've been doing the light therapy, we don't talk enough about the fact that it promotes healing. So post-procedure, these masks are a really big deal. They're going to really help you recover way faster than you would otherwise. So Tanya uses it in her room all the time after people have had a chemical peel or if they've had anything invasive. I've been doing a lot of stem cell therapy. You know, I love the stem cells, PRP. Basically your own adult stem cells from your body. But this is, stem cells and PRP are currently the most anti-aging, regenerative procedures that we have here. So we do them using the microneedling and PRP. We use the stem cell facelift gun for stem cell and PRP implantation. So I've done these procedures recently. The mask is a great way to follow up. Of course, PRP and stem cells are both anti-aging and healing, but why not finish off with the mask?
With a cool
Power Ranger.
Hannibal Lecter mask.
So the coolest thing about this, Nick, whenever I was researching it, because I'm not just dying to buy a Nobody Tell Cody $500 mask off of Derm Store, but when I read the reviews, 97% of people who bought this mask saw a noticeable improvement in both acne and fine lines and wrinkles. So sign me up. Over 10 weeks.
Sign me up too, yes. So you can order this to do at home, or you can come see us to do the light wave therapy. Or if you're hooked up to the IV, we can put the Saluma on you.
They're great add-ons. So if you're getting an IV, that's usually whenever I get my light therapy here in the office. I'm getting an IV, I'll lean back, put the Saluma on my face, or if Tanya has got me on her table, secret life coaching me while she does RF, she'll usually put the light wave on my face for me.
Yes, love it. I don't know who wore it better, Dr. Doom from Fantastic Four or Marcie Crossland. Oh, hell no. The human placenta mask.
Human placenta face mask.
Yes, everybody.
What is next?
These celebrities are so weird. Like, what is this?
J-Lo, Gwyneth. You can't put other people's placenta on your face for
Definitely
anti-aging.
not. No.
I draw a line at human placenta. I don't know, that's just, it creeps me out a little bit.
Yeah, it is kind of gross.
I mean, placenta has adult stem cells in it. I mean, it is anti-aging. It's regenerative. I mean, we have one. We do that.
We do. We have a very good one, actually, but it's an Australian sheep placenta.
Sheep placenta.
There's a
For some
difference.
reason, yeah. For some reason, it's like totally fine to put sheep placenta on your face as a mask. I'm fine with that. I did it.
Yeah.
When did I do it? Thursday, Wednesday.
When Marcie was getting this hydrogelly placenta mask the other day, I swear it was the quietest 15 minutes in MC Aesthetics history.
Did it this week. Loved it. Made my face feel amazing. There's definitely something there. We know that the sheep placenta has stem cells from the sheep, anti-aging. But I don't know, the human placenta.
The human one's creepy, guys.
And that's the big thing. They're all talking about that right now. There's human placenta in everything that the celebrities are doing. So it's going to take me a minute on this one, I feel like.
Oh, hell no.
Oh, hell no. Out. Hi, Dr. Beck. How are you?
I'm good. How are y'all doing?
Doing good. Glad to have you here.
Thank you. Thank you for having me.
So, Dr. Beck, you are not originally from West Texas.
I'm not. I grew up near Houston. I was born in a little town, Richmond, Texas. It's about 30 miles southwest of Houston. I was the youngest of 5 children, and myself and my twin brother, who's 3 hours older than me, by the way. Yeah. We're identical twins, and we grew up there in Richmond. It was a nice place to grow up.
And he's a doctor too.
He is, yeah, he is. Nick, he's an orthopedic surgeon over in Tyler, Texas.
That's awesome.
Did y'all go to medical school simultaneously at the same place?
It was interesting because when we graduated from high school, we decided to go different routes. I'd planned on going to pharmacy school, and I went to University of Texas, which was kind of a family tradition. My great-grandfather, my grandfather, and my father had all gone to Texas. Both my grandfather and my father were already pharmacists. And my oldest brother had gone to A&M, so my twin brother, Tim, decided he wanted to go to A&M.
Are you the evil twin?
No, I'm the good twin.
Can you imagine 2 of me running around? 2 of Marcie?
Oh, Lord,
Oh, my
no.
gosh.
Whoa, whoa, whoa.
No, don't get crazy.
Yeah, so I went to pharmacy school, he went to A&M, but we both ended up in it about, I think it was within the first month of our second year of college, independent of each other, not knowing the other one was doing the same thing. He made a decision to go to medical school. 2 weeks later, I told my parents that I wanted to go to medical school.
Wow.
And they were like, yeah, it was kind of just a twin thing, I guess.
That's
That gives me
awesome.
chill bumps.
Yeah.
That's so cool.
That is really
So
cool.
he ended up changing his major. He'd started out as a chemical engineering major, and I was in pharmacy school. And pharmacy is a 5-year degree program, and his degree program was 4, but he's changed, and so he ended up graduating in 4.5 years because a lot of his chemistry classes didn't count towards his biology degree. So we both entered the same medical. We applied for medical school at the same time, and we both ended up going to the UT Health Science Center in San Antonio. That was real fun. It was interesting, especially on our psych rotations. Yeah, one of us, they'd see one of us, and then the other one would come by, and they
Had
thought
them
they were
doing
going crazy.
circles.
Yeah. But anyway,
That's good.
It was a lot of fun, and we did different residencies. I went ahead and did med school and residency in San Antonio, and he went off to Tennessee to do his residency in orthopedic surgery. But yeah, and I worked in Central Texas for about 10 years, and then about almost 17 years ago, 16 years ago, pardon me, this June, July, I ended up landing out here, took a job in the ER there at Midland Memorial Hospital over at the West Campus. And after doing full-time emergency medicine for about 17 years, I just got tired of the nights and the weekends and the holidays. I love emergency medicine, but I wanted to do something where I could be my own boss and I could actually have my own business, have something I could call my own. And that's in July of 2010 when I opened up the urgent care clinic. Originally it was called First Med of Midland, and subsequently about 2 years ago changed the name to West Tex Urgent Care. And then we have the 2 clinics. The second clinic was opened up about 3.5 years ago.
That's amazing. Do you have any plans to expand?
We do. We're looking at expanding to Odessa in the very near future, and who knows from there. And we're planning on having some extra space for MC Aesthetics, by the way.
Hey,
Oh,
surprise,
man.
surprise. Hello, Odessa.
Yeah. So we're excited about that, and we'll plan on offering the BioT product there as well.
That's exciting. I'm from Odessa, so I'm all about it.
Yeah.
Odessa needs some MC aesthetics.
Sure
love.
does.
Yes, I agree. I stay very busy. I'm married. I have 5 kiddos, and most of them are grown. We have one at home who's 12 years old, and he's a handful. Love him
So
to death,
cute,
but
Tristan, so
he's
cute.
a challenge sometimes. And my wife raises and breeds horses. In fact, that's what she was doing today. Real fun.
I have never seen someone more passionate about horses in my entire life than Michelle Beck. She
You are correct.
loves her babies.
Wow.
She does.
How many does she have?
Too many.
Too many.
I think
That's
we're up to
always the
14
answer with horse people.
Yeah. We're up to 14 or 15 right now. And we've got one pony that's getting ready to foal any day. In fact, she was up all night watching her. Her name is Stormy, and we're keeping our fingers crossed that everything will go okay and she'll foal without problems. And then I still do a little bit of emergency medicine work. I'm medical director for the SANE program here, a sexual assault nurse examiner program. I sponsor a nurse practitioner in Stanton and Kermit. That's where you grew up, right, Marcie?
I'm very close to there. I went to school in Wake.
All right.
So that
Don't
was my,
Wake or you're going to miss
that
Wake,
was my
right?
hospital, Kermit. Something happened, you had to go to Kermit.
Yeah. And then I'm also the medical director for Springboard Treatment Center. It's a drug and alcohol treatment center in Midland. And then Turning Point, which is a drug and alcohol treatment center in Odessa.
I am so inspired by that, Dr. Beck. The fact that you work 80 plus hours a week and still find time to give back to causes like that in this community, I'm just really impressed
Yeah,
with that.
it's
Well, thank you. You know, it's one of those deals where I feel like God has really blessed me and my family, and I just have a real passion for giving back to the community. The community has been so good to us, and just today we did physicals over at SJ Junior High on about, 120 kids, I think, and then next week we're going to be over at Alamo Junior High doing physicals too, free physicals for the junior high sports physicals that they have to have for school. We, in fact, June 1st, we're doing a deal that's going to be co-sponsored with the Texas Medical Association. Our event is called Safety in Mind, and we'll be giving away free bike helmets for kiddos.
So cool.
Yeah, we're really excited. It's going to be on June 1st from 9 to 1 over at the park behind Lowe's. It's called, was it C.J. Kelly? Is that what it's called?
Yes, we're the Jackson Place baseball there. Yes.
Yeah.
Right behind
We did it last year, so this will be our second annual. Kent Quick's going to be there giving away hot dogs and water. We're going to have bouncy houses. We're going to have snow cones. The fire and EMS and police will be there. And I think Synergy's supposed to be there. And Peyton's Bike is going to be giving away a free bicycle on a raffle basis. So we're
That's
looking
wonderful.
forward to it.
That's great.
Dr. Beck is everywhere right now, just helping people everywhere
sure
right
is.
now.
We try. Like I said, I just really think of part of being fulfilled is being able to give back to the community, give back to other people.
100%, Dr. Beck.
We're going to be doing an event coming up on Saturday, June 1st. It'll be at C.J. Kelly Park, which is right there behind Lowe's off of Loop 250. It'll be from 9 till 1. Kent Quick will be there giving away hot dogs and water. We'll have bouncy houses and snow cones, and fire and police and EMS will be there. And let's see what else we're going to have. Snow cones. Did I say snow cones? My marketer always gives me a hard time about that because I told him, I said, if we're going to have kids there and we're going to attract them, we got to have snow cones.
Gotta have
Gotta
snow
have,
cones.
ice cream,
Yes,
snow cones,
yeah.
You'll see
something
me
cold.
in line too.
Yeah.
Yeah, and Nick. Kids and
so,
Nick.
Yeah, I mean, it's a good thing. It's giving back to the community, but it's also something that's good for the kids. I mean, we talk about safety, and we talk about headwear and protecting their head. It's amazing how many kids fall off bikes and hurt themselves, and this, having a bike helmet can prevent that. So Saturday, June 1st, C.J. Kelly Park from 9 to 1. Be there or be square.
Well, and that's amazing, just with the traffic right now in this community. I mean, I'm terrified. I won't let my kids outside without, even my older ones, without me right there because there's just so much going on the roads. I think this is a fabulous opportunity to educate Dr. Beck.
Thank you.
It's very exciting. So, Dr. Beck, we talk so much at MC Aesthetics about anti-aging and the skin and
The
getting
fountain of
younger.
youth.
Right. You got to be hydrated. We're all trying to be 6.
Yes.
We're all just.
I don't know about 6. How about 18 or 25?
Okay, we're all. If I get halfway to 6, I'll be happy.
Okay, all right.
We're all on a mission to anti-age.
Right.
The outside, the inside. We're all just trying to be our youngest, best version of ourselves, right?
Right.
All right. You do hormone replacement therapy at the North Clinic, right?
Yes.
West Tex Urgent Care. You have how many urgent care clinics right now?
I have 2 right now.
Okay.
The one on the north side is where we do our Bio-T, which is the hormone replacement therapy, and it's at 3401 Greenbrier, which is right adjacent to the intersection of Midland and Wadley. And our south clinic is out off of I-20 on Longview Street, right next to the Walmart there on the south side.
Okay, so easy option for anybody to get to in Midland. There's certainly a location that you can get to.
Yes.
That's where I go for all of my health needs. Dr. Beck is our family clinic. I love going to his clinic because I feel like you're not herded in like cattle. You take a minute with your patients, Dr. Beck.
Yes, we do. We pride ourselves on certainly trying to be efficient and be as quick as possible. But I myself and the providers that work for me, I don't ever want them to give any of our patients the impression that, like you said, that they're being herded in or out like cows or cats or dogs or whatever. So we really do try to take the time to talk to our patients, and not only talk to them, but listen to them.
And in a town as busy as Midland is right now, that is everything.
Definitely.
So, Dr. Beck, you are one of the people that has so influenced and shaped the way that I deal with my patients.
Wow.
Absolutely. You might have to wait a minute. Sometimes you got to wait for what's good. But I love that when you get into Dr. Beck's room, you are the only person on the planet.
That's important.
It is. It is.
Yeah.
I feel like you hear your patients. You take time with your patients. If there's something wrong with me or one of my children, it's the place we run. We go straight to Dr. Beck.
We're glad that you come there. We're sorry when you're sick or injured, but we're glad to take care of you when you are.
Well, you all always have the most complicated, well, I make them complicated because, nurses always have 3 days to live when we get sick. That's the thing. So when I get sick, it's always got to be a really doozy.
Well, I thought doctors made the worst patients, but I
think it's a close call probably. So y'all are also doing the hormone replacement. Yes. So talk to us about BioT and the pellets and why does one want to have a hormone pellet?
Back in the early 2000s, there was a study called the Women's Health Initiative Study, and it was basically using synthetic hormones for women that were menopausal or postmenopausal. And we definitely know that some of those medications help relieve menopausal symptoms in women, of which the main ones can be moodiness, irritability, vaginal dryness. Those are the kind of symptoms that a lot of women experience when they're having menopause. And the study showed that one arm of the study that was using the artificial or the synthetic hormone, Premarin is what the product was, had a slightly higher risk of breast cancer. Now, I'm not saying that study was perfect, but it was done. They stopped the study prematurely, and all of a sudden you had doctors who weren't prescribing estrogen or some type of hormone, the typical hormone replacements that women were getting for menopause. So you had a lot of unhappy women, and if you got a lot of unhappy women, it kind of falls through that there's going to be a lot of men who aren't happy too. So that's how BioT got its start. And Dr. Gary Donovich, who started BioT, realized that there was another option. One of the problems with the synthetics is that they have to be metabolized in the body. And so the thought process is that it's not just the hormone, it's the fact that it's a synthetic hormone that might have, and I say might have, put some women at increased risk of breast cancer. So he got the hormones just like our body uses, and that's what we refer to as bioidentical hormones, estrogen, and tried it in women, and it's in the form of pellets, and they're put in the subcutaneous tissue. And not only do we try to optimize the female sex hormones, but also the other hormones in our body, make sure that our vitamin levels are good, make sure that our thyroid gland is working properly. And a lot of people have subclinical hypothyroidism, which is another way of saying maybe their labs look okay, but symptom-wise, and if you look at their labs closely, you may be able to detect that they might benefit from, say, more of a natural type of thyroid.
Kind of a borderline situation.
Exactly. So we look at all of that, and we try to basically tailor-make our each individual person's hormone therapy to what their labs are, but not just what their labs. We don't just treat labs, we treat their symptoms. And so that's kind of what bioidentical hormone replacement therapy is about. I think it's important to understand how the company got its start. You know what I mean? And then also in some women, they can benefit from testosterone therapy. And then we also do testosterone replacement therapy in men as well.
Would I be a candidate, an ideal candidate?
Possibly. What we look at, Nick, is we look at the symptoms that you may be having. And it's amazing how many men out there have low testosterone. They don't even know it.
Right.
They attribute maybe the fatigue that they're having to maybe I'm just worried. I'm staying up too late and doing other things that may not be healthy. But the only way to really know is to basically do a blood panel to see what your testosterone level is. But there's a number of men in their late 30s or certainly in their 40s, and as men get older, that naturally that testosterone tends to drop off. And it gets below a certain level, and a man can't even achieve an erection. So, I mean, there's all kinds of problems that go along with that.
It surprises a lot of men who are younger having some of those problems. They think, oh, it can't be that, it can't be that. When they have a panel run, they notice that their testosterone is way lower than it should be.
Yeah.
So
it was with
age
me.
doesn't matter.
Yeah.
I think that's a huge thing. What age do you typically see for a woman or for a man that kind of nosedive in hormone levels?
Yeah, in women, the ovaries make the sex hormones in women. The women have testosterone in their system, as I kind of already referred to. Women their ovaries make testosterone and estrogen. The one that most people are familiar with is more the estrogen because Well, men don't have that, but
Right.
that's the hormone that's mainly involved with menopause. When estrogen levels drop from decreased production by the ovaries or stopping production, that's when a woman will experience or go through menopause. But in women, the ovaries stop making testosterone much sooner than they stop making estrogen. So the symptoms of low testosterone in women, again, women do have testosterone, but it's just in much lower levels than men have. So as women's testosterone level falls, they'll experience some of the same symptoms that a man may have, but just not to as much a degree maybe. But they'll feel like, I'm just tired all the time, I have no energy, and libido, it can also affect libido. So it can affect marriages too. I can tell you specific examples of a woman who came to us and her hormones were just so off the wall. Basically, she had none. And we started her on testosterone and estrogen because she was menopausal. And she basically came back, after a couple of pellets, she said, you saved my marriage.
Well, it was a game changer for me. What is a normal limit or the normal window for someone, a woman testosterone? What is that window?
Well, again, and this is where the bioidentical hormone replacement therapy or BioT is a little bit different than some, because if you just look at a lab reference for testosterone in a woman, normal reference is going to say, again, this is made up by labs, they just make normal levels.
Right.
A normal testosterone level in a woman may be, say, less than 60. That may vary from lab to lab slightly. But what we do with BioT is we know that there's going to be little or no harm if we bump that up just a little bit because of the health benefits. They will feel better, they will sleep better, they will have less mental fogginess, more energy, better libido.
It's
a lot of
also
them have
preventative, right?
Yeah, and it also can help their skin sometimes too. I don't talk about that much because that's not a big deal for some women, but it is for other women. Especially, they don't always start out coming in just for their skin, but they do notice increased benefits to their skin. They say, my skin feels more supple, more soft, it looks younger.
That was when my mom got her pellet, that was the first noticeable change. I didn't see her for 3 or 4 months, and when I saw her, her skin had a definite change.
Yeah.
But it is preventative for
Yes.
osteoporosis, Alzheimer's.
Yes, yeah. Now, what we're referring to there is the estrogen component, of course.
Okay.
And women that are menopausal, the estrogen also helps prevent bone loss from the bones, or what we call osteoporosis. And a lot of people may be familiar with osteoporosis, but if you're not, basically it makes the bones much more friable or fragile. And so a woman is going to be much more susceptible to a fracture. It could be a hip fracture, a fracture in the back, what we call compression fractures in the lumbar spine or other parts of the back. A simple fall may result in a wrist fracture. It can be a real problem. And the bad thing about osteoporosis is once it happens, past a certain degree, it's irreversible. So
Right.
it's being proactive and getting those adequate hormones. Well, again, because it's bioidentical, we're not going to increase the risk or run the risk of any increased risk of breast cancer because it's bioidentical. Again, the hormones that we receive in the pellet form are not made from humans, they're not derived from humans, they are actually derived from plants, but they are identical to the hormones that are in our body.
I know for me, the biggest changes that I saw, increased lean muscle mass, increased sex drive, mental clarity, so much mental clarity, and my energy levels. For me, those were huge, huge changes that I needed in my life at the moment. The negative or the side effects, I have a little bit of facial hair, nothing dermaplaning can't take care of.
What is dermaplaning?
Dermaplaning is basically a scalpel that is going to exfoliate the top layer of skin while it gets rid of the facial hair.
It's so satisfying to see too.
It is fun.
I love those videos.
It's like a little skin baby. Yeah, like you have your skin baby. So we have dermaplaning for that. We have Botox or Dysport for hyperhidrosis or excessive sweating.
Right.
We can actually inject the underarms. We can also treat the face, palms, soles of the feet.
How do you treat the palms and the soles of the feet?
So we have a really neat little tool, our little Aqua Gold tool that we've been using here at MC Aesthetics. We can put little tiny amounts of Botox and actually get really good coverage at just the right depth for hands and feet. So it's been a really nice little tool for
It's like a little stamp.
Yes, and it has 24 karat gold straws that actually feed or implant the Botox, and all at the same level. And so you're able to get better coverage than trying to use your little insulin syringe.
Nice.
So you get it the
Very
right
neat.
depth. Really neat, great for the face too. The reason we put the Botox in the little reservoir of the Aqua Gold is so that it can minimize pores. Botox used in trace amounts on the face is going to treat hyperhidrosis and it's going to minimize pores. So we have lots of ways to treat those unwanted side effects. Acne can be a little bit of a problem, we know.
Yeah, and it's kind of strange because you never know who's going to experience that. And you know, the interesting thing is most women, whether it's a little bit of acne, because it's usually mild and it usually gets better after they've been on the pellets for a month or so, but it can still be bothersome. So we have the option of, you know, there's definitely some options that you offer. Occasionally we'll even use a short course of antibiotics and in the facial hair. But most women are willing to, because they feel so much better with the hormone replacement therapy, they're willing to seek other alternatives or other options for treating the side effects or just tolerate the side effects. But why not come in here and see you, right?
Hey, we can fix it all. Yeah. But for me, the side effects aren't even a thing. Like, it's not any reason that I would consider not getting my pellet, certainly.
Now it's time for our DNR. Dr. Beck, do you have any embarrassing moments?
I forgot all my embarrassing moments.
I bet you did.
I try to erase those kind of things. But I was talking to Marcie, and I was really racking my brain trying to come up with something. And I remembered something that happened. It's been a long time ago. It's been about 15 years ago. But when I was in undergrad school at UT, I was working a summer job on a construction crew and injured my leg. And over a period of 2 years, actually, it was at the end of my first year of medical school, I ended up having to have my left leg amputated below the knee. And I had taken my daughter skiing, I believe it was in Winter Park, Colorado, and we were on the chairlift. And I guess I had been perspiring or something, but I noticed that my prosthesis started slipping and it started coming off, and I tried to grab it, and next thing I know, my prosthetic leg slips off my leg and falls down to the ground. Had a ski on it, had the prosthesis and the ski boot and everything.
It's not funny, not funny.
I mean, if that
I
hits
can
you in
laugh
the
about
head,
it now.
though.
Fortunately, there was no one below us, at least not directly below us. Somebody did catch it, or it started going down the hill.
It skied on down.
A little ways, anyway. Somebody got it, grabbed it, and carried it up. We were almost up to the chairlift. It didn't fall too far. Nothing was damaged, and I was able to get it and put it back on, and we continued to ski.
On down the mountain.
Yeah.
Whoa. Yeah, you win.
Yeah, you're winning. Thank you so much, Dr. Beck. Thank you for being here.
Thank you for having me.
For being so innovative and for being such a leader in the community and for being such a huge part of all that we're doing up here. And
I just think it's amazing and exciting, all the stuff that you do, Marcie, and it's just such a pleasure to work with you because, you know, you were talking about me being your mentor or someone that you look up to, and I'm thinking, like, I think it's the other way around. When I see you with patients and how you treat your patients and you allow them to have access to your phone and be able to communicate with you after regular hours, I mean, that's one reason why you're so busy.
oh, well, thank you, Dr. Beck. I appreciate that. I will take a compliment from you any day of the week.
Y'all are both pretty great.
Well, thanks, Nick. Cheers, guys.
Cheers to that.